The next skill we will discuss is action planning. In healthcare, evidence shows that people who actively participate in and make decisions about their care are more likely to adhere to care plans and show improved health outcomes. While contact tracing occurs outside of clinic walls, contacts who are involved in decision making and action planning are more likely to observe quarantine and enact prevention measures than those who are simply told what to do. A goal that contact tracers frequently discuss with contacts is quarantining. This goal can seem daunting and difficult to envision in the complex context of people's lives. An action plan is a small, short-term activity that takes people one step closer to meeting that goal. Action plans work best when the contact determines what they will do. When the contact tracer tells the contact what to do without finding out their resources, priorities, and concerns, it is less effective. In the following scene, we'll see an example of how a contact tracer tells a contact what to do without getting their input.
Okay, now that we have talked about your symptoms and exposures, I'm going to create an action plan for you to quarantine for 2 weeks starting now.
Okay.
Don't go out at all, even to the store. Stay in a separate room from other people in your house and don't come in contact with them.
Really?
Have someone bring food to your door at meal times. And tonight, tell your spouse that they will have to take care of the kids.
You've got to be kidding.
You'll get a text every day to see how you're feeling.
In the previous scene, the contact tracer let the contact know that he needed to quarantine without engaging him in a discussion about his understanding of quarantine, how he might carry it out in his life, or his motivation to adhere to it. Because the contact tracer asks no questions, we do not know about the barriers the contact faces or the changes he's willing and able to make. The more effective approach to action planning encourages the contact to be an active participant in planning for quarantine. There are 5 steps to create an action plan. 1. Have the contact choose. Ask the contact what might work for them, and then, if needed, offer a menu of options for them to consider. 2. Ask questions to get specific. Ask questions like who, what, when, and how to make the plan as specific as possible. 3. Use a confidence ruler. Ask the contact on a scale of 0 to 10 how confident they are that they will be able to carry out the plan. If they answer a number less than 7, ask what they could do to refine the plan and get to a 7. 4. Ask about follow-up. If your site allows, ask if you can follow up with the contact in a few days to ask about the plan. 5. Close the loop. Ask the contact to review the plan in their own words. In the next scene, we'll see an example of how a contact tracer uses action planning to engage the contact as an active partner in planning for quarantine. Try to identify the steps and prompts used, and we'll review them after the clip.
It sounds like feeling lonely is one hard thing about quarantine. What else is challenging about it? For example, some people have living situations that can make it challenging.
Well, I'm concerned about getting food. I'm unemployed and I don't have money for takeout every day.
Should we make an action plan together to figure out how you can get food?
Yes, let's do that.
What are your options for getting groceries for the 2 weeks?
I could ask my brother for help. He'd definitely bring some groceries and some of my sister's rice and beans if I asked.
That's a great idea. And what's the first step to make that happen?
I could text him.
Perfect. And when do you think you can text him?
I'll do it tonight.
And when your brother comes, how can you get the food without coming into contact with him?
Oh, right. Well, I can have him leave things at my door and not come inside.
Excellent. Let's review how confident you are about this plan. On a 0 to 10 scale, with 10 being very confident, how confident are you that this action plan will work?
It's a 10. I know it will work.
Before we get off the phone, I know that we talked about a lot of things today, and to make sure that we're on the same page, would you mind describing what your action plan is?
I have to stay home for 2 weeks and avoid exposing others in my home.
That's correct. And what will you do tonight?
I'll text my brother to see if he can leave some groceries on my doorstep.
That sounds great. I want to thank you for what you are doing to keep your community safe.
In the previous scenario, the contact tracer laid the foundation for the contact to identify a small step or action plan to be able to quarantine successfully. By asking what would be challenging about quarantine, the contact tracer gave the contact a chance to identify something that he could work on to be in a better position for quarantine. In this case, the contact identified a lack of food in the house as one priority issue. There are many ways to get food, which is why the contact tracer asks, "What do you think your options are for getting groceries?" She then probes for specifics with the questions, "What's the first step to make that happen?" And "When do you think you can text your brother?" She also assesses his knowledge of how to do a safe handoff by asking, "And when your brother comes, how can you get the food without coming into contact with him?" She uses a confidence ruler, asking, on a scale of 0 to 10, with 10 being very confident, how confident are you that you can make this action plan work? If he had given a number less than 7, she could have asked what changes he could make to the plan to get to a 7 or higher. Finally, the contact tracer closes the loop on the plan's details. She says, "I know we talked about a lot of things today, and to make sure we are on the same page, would you mind describing what your action plan is?" Action plans are a great tool to use when helping a contact troubleshoot any problems they might have during quarantine, such as getting groceries, childcare, or testing. The more specific the action plan, the more likely they are to act on it.